Hi guys, this is your girl Ruby here once again with you for another day, and I hope we're all doing well, in the best of health and wealth. So today I want to talk with you guys or share with you guys is about the medical port. I am not a medical doctor, right? The only association I have with doctors are going to the doctors, all right? I'm the patient. But most of my experience, they're real. They're stuff that actually happens to me, and I would like to highlight you guys. I'll be glimpsing at my papers because I have a little notes, right? So today, as I mentioned, I want to talk about the power port. It is also called a medical port. And the question is, what is a medical port? It's a small disc shape that is surgically implanted under the skin. This is a thin, flexible tube called a catheter, which connects to the port to a major vein. This is usually placed on the upper right chest, right? And this is what it actually looks like. I'm going to show you mine, right? So it's placed right here and it's connected to the vein here, and then it comes down right here, if you can see right there, and it's underneath the skin. All right, the port is used to um to to do fusion treatments, right, and also to administrate antibiotics and other medications. It is used on a patient for drawing blood samples. That is for patients who goes into the lab on a regular basis for drawing blood samples, because you don't want to end up with sleepy veins. Because if you're going to go in the lab every week and they're going to be poking your veins, they're eventually going to be sore. They're eventually going to be sore, and you don't want to end up with that, right? So that's the reason why they put the port in. The port is also used to deliver infuse for solution for like CT scans and MRI. Whenever time you go to do that CT or MRI, and they told you that they tell you that it's gonna be like with contrast, so they do half the images, and then the other half they said, okay, ma'am, I'm gonna now administrate your contrast, and then you feel that warm thing. For the ladies, you feel it down that little place there, gets very hot, right? That's feeling, right? So that is it. um the day after your port placement, what we should know, right? We should avoid getting that area wet for the first 24 hours. So if you can take a sponge bath, that is good for you, right? Whatever works for you, make it works for you, right? If you don't feel like taking a bath, hey, it's your bed. I'm not sleeping beside you, right? Right? And no heavy lifting over 10 pounds for the first 24 hours, right? Avoid heavy lifting, right? Also, when you put the port in, right? The port comes in a little pack, and they give you, it comes with a wristband. It comes with a wristband. You should always have this on your arm. Always have this little band on your arm, right? It also comes with a travel card. It's not it's not going to take you through the airport, right? It cannot take you on the train or the bus, but it can take you places, right? So you should always have this card in your wallet with you once you have this port in. My reasons are, should in case you're going down the road and mishap do happen sometimes, with this, and you meet in an emergency and you go to the hospital, they're going to see this on your hand. Or if an ambulance should come, if something happens on the road and an ambulance should come, they're going to see this on your hand. So immediately they're going to know that, hey, that one has a port in. So instead of porting you here, they're going to go here, right? To do whatever they have to do, right? So you have to have it so they can see, right? The port normally stays in between like a couple of months. Some people will have it in for 6 years, because they don't want to go through the hassle of going back again through anesthesia to get the port in, the first couple of nights, uncomfortable sleeping and all of that. They don't want to go through that old rigmarole again. So they chooses, they might ask you, are you ready to take your port out now, ma'am? And it's your choice to say yes, or you feel comfortable with this little thing inside of you just make it stay. But you have to go in, I think it's every 6 weeks, if I'm not sure. If I'm not sure and you're watching and you can choose to correct me, please do, because I'm not sure. You have to go in to get it flush. Because the port can be infected and you don't want to get your port infected. All right. And some people will say don't sleep on the side that the port is in. For me, when I got my port placement the first couple of nights, I couldn't sleep on that side, and that's my sleep side. So it was very uncomfortable for me to sleep, right?